of the breast cancer patient, especially in the moment of post-mastectomy. All process of breast cancer doesn't affect just physical side. It provides a great psychosocial impact in these women and they experience many feelings and emotional changes.
On the breast. Next. Core needle biopsies can be done. Core needle biopsies give us a larger tissue than what we get in fine needle aspiration cytology. There are certain gadgets, there are certain needles that are used for this needle core biopsy, and this should no more be considered as a stigma or a taboo in our society. As I can see that 90% of the audience here are females, and breast cancer definitely is a disease of female breast. It can also be seen in the male breast, but the large number is seen in the female breast. So these awareness campaigns are carried out to ensure and to reinforce this thing in our females that they should be open about talking about this disease. Breast cancer, I again repeat, is not a stigma, it's not a taboo, it's not somebody's own fault to have this disease. Breast cancer is a disease just like getting flu, just like getting dyspepsia, just like getting appendicitis. So it's a disease just like any other disease of one's body. So every female should be open about this disease. They should feel free to come to a doctor to get themselves examined. And if they have any kind of a lump or any other problem in the breast, they should immediately discuss it with some family members. If the girls, they're not very comfortable talking it with the male family members, they can talk about it with their mothers, with their sisters, or any female doctors. So first thing should be clear in your mind that breast cancer is not a stigma, it's a disease like any other disease, and one should be open about this disease. Secondly, these awareness programs are carried to educate the general population and especially you people who are related to the medical science. Just remember, the treatment of breast cancer starts with the education of the people. It starts with the education of the society. Believe in me, there are so many myths prevalent in our society, as a result of which we see females coming to us in stage 4 disease. So at stage 4 disease, the treatment is not possible for those patients. So would they have been open about this disease, not listen to those myths? Those patients can easily be treated in the stage 1 disease. How often should it be done? Because that would be covered by the radiology department. Okay, moving on to the lab tests that are required for diagnosing the breast cancers. Again, in the end, मैं आपको बताऊंगी what are the certain myths and facts about the breast cancer. But moving on to the details of the breast cancer, एक बहुत common myth जो है, which is about the breast cancer, is that breast cancer it just increases or it goes to the other organs of the body just by putting a metallic object into it in the form of a needle or a knife or a scalpel, or if you give an incision onto the breast or if you give an incision onto that lump, this disease is going to clear up. This is just a myth. Nothing happens with the FNAC test, nothing happens with biopsy. And these are essential tests for diagnosing and treating these patients. So fine needle aspiration cytology is the first and the foremost test which is carried out, next please, for diagnosing these breast cancers in the lab. The results of FNAC are 97 to 98% specific and sensitive. This is not a 100% accurate test. 100% accurate test is about biopsy and histological evaluation and diagnosis of the breast cancers. So how this test is done? Just go home and tell your mothers, your sisters, and other relatives. There's no fear of there shouldn't be any fear about this test. This is a very simple test. This is done on OPD basis. No anesthesia is required for this test. This is just like giving a small IV injection to any patient, or even lesser than getting a drip at a hospital. What we do is that we just take a small needle, maybe 3 cc or a 5 cc needle. We just put it in the test, we take out certain fluid and certain cells from that area, and then we see it under the microscope and we tell the patient that whether it's a benign lesion or it's a malignant lesion. Next please. No local anesthesia or no general anesthesia is given for this fine needle aspiration cytology test. So just make this thing clear in your mind and take this message home that this is a very simple test done on OPD basis. Takes a minute to do this test. It's a non-invasive and it's not painful at all. Next. Ultrasound guided fine needle aspirations can also be done for deep-seated lesions and for the lesions which are very small. As you can see here, that this white thing is a probe of the ultrasound that is put on the lesion on the breast, and we see the lump on the screen if it is small in size. And with the help of that image on the screen, we put in the needle and take the material. The rest
Department. Thank you so much, ma'am, for your presence and time.